programs. So glad to be here, recording in progress. And today we have a full agenda. First, I'm going to kick it over to James here in a moment, who's going to share with us a quick commercial break, as I call it, on how to keep EBT cards safe. Followed by, we're going to have a conversation around the ODHS transformation project that's rolling out from Sherelle Jackson. And then we'll have a YEP, Youth Experiencing Homelessness Program update, and maybe even time for some Q&A at the end. So without further ado, James, you want to kick it off with EBT safety information?
Yeah, just sort of plop that up on the screen, but this is an issue that we have been hearing about and is important for you and your clients to know about, because there's card skimming, there's all sorts of issues that are going on. And and so, as you can see, we've got new tools to for you to share with your clients. And so one thing I want to emphasize right now is that please encourage people to use the ebtedge.com website. I know it's clunky. Well, actually, I don't know. So I've heard it's clunky, but it's really important, because through that you can change your settings to block out-of-state purchases and online purchases, because that's how a lot of the scammers work. They'll skim the number and then suddenly you get charges from New Jersey or something. And so so that is possible. But if you also go to our website, which I'm going to drop in the chat, you know, and keep putting in your information. So, but take a quick look at that chat that's rapidly scrolling up, and you can find this website where I've got a couple screenshots from it. If you scroll all the way to the bottom of the website, you'll see more ways to protect your benefits. And if you click that open at the very bottom of that, you can also find flyers and brochures and wallet cards. Now, I don't know what your budget is for printing color documents out, but nonetheless, these are helpful things that you can put up in your office or offer to people. The QR code that you see takes you to the same website that I was just posting. And it's just important information for people so they can do what they can to prevent their card number from being stolen. So that's what I have. So I am going to stop sharing, and I hope if you have any questions, let us know. But
thank you, James. Wonderful. Look at that. We're right on time, right at 2:10. Almost like we planned it that way. Great.
Oh, Beth, Beth has a question.
Oh, yeah, Beth, go for it.
Thank you. And I really appreciate those tools are super helpful. I'm going to really try to make sure our folks know to spread the word to our clients. I was just wondering, in addition to those tools, is Oregon in line to get, I understand there's kind of like a waiting line of some sort to get chip cards with the safety protection on them. Like some state, I've heard some states say that they're sort of in line for that. Is that is that a plan for Oregon?
I can speak to that, James. So Jessica Maya Hoffman, I'm the Deputy Director for Self-Sufficiency, and I'm actually leading up that project. We so there are two nationwide vendors. FIS is one of them. I can never remember the other company's name. They do have a line. I spoke with our colleagues in New York and New Jersey just a couple months ago, and they were talking about being in line. FIS does not have a line, so to speak, but we just communicated with them earlier this month. They got us some updated projections on what they are thinking. There are two states that are still in pilot, and they have been in their pilot stage of rolling out those chipped cards since the fall, California and Oklahoma. California has the same vendor that we have, FIS. And they are still in pilot stage. So they have not been able to roll out their chipped cards throughout the state, even though they started in the fall, because it is a process. And part of the issue is that retailers who use those chipped cards, it's a big lift for them to update their systems to be able to take the chipped cards. So even though many people in California have the chipped cards, they're not all working as chip cards. They're still having to swipe them, as many of us with our credit or debit cards have swipe and chip. So we are working on the process for when Oregon might be able to do that. There is a significant cost. It is quite expensive, and it's not going to fix all of the problem, although it is more secure. And I absolutely recognize that, which is why we are really pushing to get to be able to do that as soon as possible. So
thank you so much. So
you're welcome.
Are we in line, or are we, is it like a plan, but we're not in the queue yet?
My understanding is FIS does not have an order in which they're going to roll it out. They know that Oregon wants to, and we've gone through 2 different processes of talking with them to get what the cost will be. So they've sent us 3 different estimates, one in January and then an updated one. So we're not in line because there's not a line, but we do already have our estimates, and we're working with them on which approach we want to take.
Okay, that sounds good. Thanks for the update. And then just
You're
a
welcome.
follow-up question. I'm sorry
Sure.
if I hope I'm not taking too
No,
much time,
it's okay.
but, is there any discussion at all about Oregon continuing to replace stolen benefits, even though the feds aren't supporting that at the moment, to my knowledge?
The federal government is not, and we would need legislative approval to be able to do that. So at this stage, we do not have legislative approval for Oregon to use general funds to replace stolen EBT SNAP benefits. We are still replacing stolen TANF benefits, but we do not have the ability to replace stolen SNAP benefits.
Great questions. Thank you, Beth, and thank you, Jessica. Appreciate that response. Wonderful. Well, without further ado, to keep on our tight but exciting timeline for this agenda, I believe next up we do have Sherelle Jackson, the ODHS Chief Service Delivery Officer, who's going to be presenting to us on the ODHS Transformation Project, what that is, what that means for us, community, partners. So I believe I saw Sherelle. I will hand off to you.
Thank you very much. You did. And I have a couple people with me. So I will introduce myself, as you said, Sherelle Jackson. I am our interim Chief Service Delivery Officer. I have the privilege of being able to be a co-lead on this project around ODHS transformation. And I have Crystal here and I have Maria. Maria, would you like to introduce yourself?
Thank you, Sherelle. Good afternoon, everyone. Maria Ross. I use she, her, aya pronouns, and I'm the Deputy Chief Operating Officer for Strategy and Implementation, which in part means that I get to lead this exciting project alongside Sherelle. So good to be with you. And we do have a couple of our service equity managers with us today as well to really support this conversation. So I believe Frida is with us. And then, did you say Crystal as well, Sherelle? The
I
party
believe
today.
so. You all want to introduce yourselves? Crystal, did you want to introduce yourself?
Is it me? Me, Crystal? Or is there another Crystal?
I thought it was you and perhaps Frida. Frida, are you with us? We can get started and
I'm
then.
here.
Oh, there we go. Hey, Frida, you want to introduce yourself?
Frida Bikere, she, her. I am the service equipment manager supporting SSP. Glad to be here.
Awesome. Thank you. We like to let you know who's here with us when we're having these conversations. And so thank you so much for allowing us to be here. We wanted to have some time to talk with you about our work, and I will let Maria get us started and then happy to jump in to continue to share about how we are evolving.
Thank you. And thank you for giving us some space with you today. So the Transformation Project is an effort that began last summer. We're actually coming up on almost a year since beginning this. And we started with an organizational assessment with the Human Services Group, who we'll also refer to as HSG. And they took about 90 days. I think it actually ended up being closer to 4 months, but we'll let it go. To meet with over 500 staff across the organization, primarily around service delivery, to answer the question, what would the agency look like if we were structured to really center the customer and the client at every level of our structure? And along that work was a lot of interviews. They did in-person work sessions and across different parts of the state as well, and then put together a pretty robust report. So what we have done since then is really work on how can we begin doing the harder work of designing what it looks like to implement those recommendations and achieve the outcomes that we heard from the staff and what we've heard in community gatherings for years, frankly, and from tribes around how ODHS is working despite the organizational challenges and is really not working because of the organizational challenges. So that's where we are right now. We've been deep in design work since then, and I'll kick it over to Sherelle to give you a little bit more detail about those components.
Thank you. We are seeking to do a few things. One of the things that we're seeking to do is to build a service delivery division or portfolio. Another is to develop an administrative hub to support local districts. And then the third is to bring together our child welfare and self-sufficiency programs into a more unified continuum. I'll share with you a little bit about what's happening in service delivery and then kind of walk through those things. And then I would love to kind of pause and hear thoughts and ideas and get feedback or questions. For service delivery, we're seeking to develop an ODHS portfolio that oversees the operations and services of our service delivery, which are services provided to children and families out of our storefront offices or branches. We interchange the name. And so while we're doing this, we've received feedback in various places that we need to strengthen our customer service. And so our North Star is to be better at how we serve children and families and community in our branches, online, on the phone, really intersect where children and families and Oregonians touch our system. With the service delivery portfolio, we have a clear lane for supporting local leaders to be able to be responsive to community directly, timely, and collaboratively. Operationally, this gives us, ODHS, a stronger ability to support local services that operate out of our approximately 160 storefront offices or branches that are across the state of Oregon. And through the lens of collaboration, it allows us to create a lane that will allow us to have more strategic ability to enhance how we collaborate across agency. So for example, being able to create processes that allow for intentional pathways where, say, eligibility workers and case managers can collaborate better together, or for workers in a program, for example, say self-sufficiency, to be familiar with other programs within ODHS to be able to help coordinate across to those programs for families they're serving. In our current state, we don't have a system design that allows us to be intentional like this. And so we're having to innovate and be creative and kind of think through how we can do it district by district versus uniformly from a state of Oregon perspective. And then we have to look to one of our 6 divisions to address issues. For example, if issues were to arise, say, in a particular district, rather than being able to look to service delivery as a portfolio and say, this is happening, we need some support, can you assist us so we can get to resolve to be able to support families and communities quicker, we would, depending upon where the issues seem to kind of come up, would either have to reach up to, say, self-sufficiency, or to, say, child welfare, or to, say, aging and people with disabilities, et cetera, when we have multiple programs, for example, that exist in a facility. So this is our aim to try to improve that. For the aligning of the child welfare and self-sufficiency program or continuum, what we're doing is we're trying to build a child and family services portfolio that brings into it both child welfare and self-sufficiency programs. And in building this child and family services portfolio, we want to redesign how we deliver services in a more uniform, unified model for children and families. And why we're thinking of doing this is we're responding to feedback from many regarding how we've bifurcated our programs and created silos. We recognize that in current state, we have gaps regarding how families experience us. We aren't collaborating across programs in a seamless way. We require families to have to go through multiple intake channels to access services. In some spaces, even, we're duplicating services. So for example, if we have a case manager, a family coach, and self-sufficiency seeking to support or help a family, if they happen to also be a family who touches our child welfare system, this family is in need of support. It's often difficult at times to know who's on first with regards to, can I help get utilities paid for this family? Can I help with rent assistance for this family? Can I help get furniture in the home? And so through a child welfare lens, we might be thinking about it through the lens of, we want to do all of these things so this family can be supported and this child can stay home with family. And through the self-sufficiency lens, we may not be having that perspective, but we may be thinking about, how can we do this to really create stability and help address the issues around poverty that this family might be impacted by? And so we want to be able to do better at how we are holistically supporting and approaching how we support a family in this way. We want to do better at addressing families' holistic needs and to do so in a way that doesn't require them to have to go through multiple processes to get help, how many times they have to tell their story, how many different people they have to touch in order to be supported, case plans that might not line up, service needs that, or support needs that they might need that they may not be able to access because perhaps self-sufficiency might say, hey, we're limited on the dollar that we have, but over here we might have a dollar to be able to support, but we don't know that. So this is our way of really trying to kind of bring those things together and think through sort of a social determinants of health concept for how to broach supporting family as a whole, to be able to also help them not only through the lens of when they came into the office and they're saying, hey, may I get some support right now with, say, TANF or EBT support. When we're hearing the full story, we might also be able to say, I understand that there's an aging parent in your home and you're trying to provide support. Can I tell you about our aging and people with disabilities program? Or I'm understanding that you're trying to kind of get back into work and you're looking at some training opportunities, et cetera. Did you know we have a vocational rehabilitation services program? Those kinds of things. So when we are aligned in more of a unified approach, we have a better ability to be able to do that. And then the other thing that we're making sense of is right now we have 16 districts. These districts each operate sort of individually and still under the auspices of ODHS and under the programs of the 6 divisions that we have. And at any point in time, there is some resource or support that this district might need through the lens of, say, like fleet or contracting or budgeting or facilities needs, et cetera. And in today's current state, there isn't a pathway other than one central pathway for all 16 districts to try and seek support when things come up in their facilities. And what that is doing, based on feedback that we have, is it's creating sort of a disparity in how districts across the state are receiving support. Some districts get more attention, maybe metro areas, for example, and can get access to resources in a quicker way and perhaps more resource, while say maybe some smaller rural or other districts might not. And this really creates disparity in how we're able to support districts who are serving community. So we're trying to think through how we can group these districts into regions and then create a hub, an administrative hub that really provides infrastructural resource support for those regions to be able to now have ways where each regional area can have their pathway to be able to access and draw down resource that'll help allow for them to be able to do their best work in community. So these are the things that we're seeking to build right now. And this is the work that we're moving through. I kind of said a lot, so I want to pause and see if there are questions.
This is Maria. I just want to uplift a question in the chat. And Beth, thank you for asking it around getting more detailed materials. And we are in the process of developing those right now. And that will include a full list of the recommendations that we are working through. The question in the chat was specifically around the HSG recommendation report. And we haven't shared that publicly just because not all the recommendations are moving forward. And even internally within our staff, every time it comes up, I then get a number of questions and concerns and frankly, anxiety on the back end for things that we're not moving forward right now, because we know that there's a lot more work that needs to be done before we're ready to do that. And the big area of work that I will use as an example is actually around joining some of our other program areas, like aging people with disabilities and Office of Developmental Disabilities. They have a very broad partner network that is contracted out and do a lot of the work around them. And the last thing we want is them thinking that we're moving forward with a change like that without having really engaged them in how that's going to take place or the timeline for that. So we will get materials to you. We're hoping to have that in the next few weeks. We will be sure that when that happens and the website's up, we're able to share that with you. We're also working on having an email address and a feedback link attached to that, so you all can continue to engage with us outside of course, always you can reach out to us at any point as well.
Are there other thoughts or questions that you have, or even ideas that as we're trying to design what we're talking about, you would say, you know, it's really important that you keep this in the forefront, or, you know, make sense of this because these are some of the challenges or gaps that we experience when we touch your system. An example, as you're building out your administrative hub and you're thinking about how you're going to help create more infrastructure and support around contracting, can you make sure that as new contractors are coming on, the contracting process is more streamlined? We have access to tracks and other systems in a much more efficient way. I'm just making up stuff, but just, are there any things that kind of come up for you as you're hearing, this is what ODHS is trying to do, for us to maybe be able to use that and lift up your voice as we're trying to, you know, move through these design spaces?
I
I took
imagine
a
partners
moment for it.
probably.
Go ahead, Catherine.
Oh, I was just going to share. I imagine partners are kind of digesting this, and I imagine this probably is the beginning of a conversation. So I
It
can also see
is.
Jace having to come back and share updates as they come. But
No,
but
absolutely. I paused that long on purpose because I happen to be an internal processor as well as an external processor. It's weird when you're both. And so sometimes I need that moment to just get my thoughts together. And so I wanted to afford the opportunity here as well. Figure out how to really support people to avoid charges of intentional program violations would be super important. Thank you. This is wonderful feedback. I really appreciate that. Absolutely. Okay. Totally. Beth, you have your hand up.
Sorry, I just thought of something else, but it would seem like too much to type, which is this might seem outside the scope of what you're talking about, but I'm I'm just getting increasingly worried that that there may be changes imposed by the federal government on various programs. And I actually wonder if we're gonna need to have some coordination between the like the TANF and the SNAP and the Medicaid program, if work required, like if people are going to have to be proving that they've done volunteer hours or work hours, and maybe there can be linking between the jobs program or any other programs that people are already reporting on. For example, for SNAP benefits, if you're in the adults without dependent children, you might already have to be proving that you either meet an exemption or you are doing a certain number of hours. So that kind of like linking those systems for that purpose might turn out to be important.
I want to echo that. And we agree with you. What we're doing internally, and Maria, feel free to lift up anything that you might want to share, is really bringing a team together to, again, this would be adjacent to the project, but still intersecting with it, to really dive into that directly, to really understand it, make sense of it. We are reviewing it really weekly to see, what evolutions exist that we will need to, be planful around, perhaps have conversations with you with, et cetera. And then that team is working with us in terms of giving us weekly updates and downloads on here's some evolutions, here's some things that are changing, here's how you might want to think about it. Where can we have conversations to really make sense of the world related to this? And so I think you bring up a really important point, because we also realize that as this is happening, the world around us, especially through the federal lens, is evolving and changing. And so we know that there's going to be some direct impacts and we have to make sense of it. So I really appreciate you calling that out. Maria, would you lift up or add anything else to that?
Yeah, I just want to echo gratitude for the question, Beth, and just really appreciate just the deep compassion for what folks are having to experience as we try to prepare for what might be coming. So yes, we do have a work group that is meeting regularly and looking and planning for potential policy changes and how we may be able to prepare for the impact of those changes. And specifically on what you're saying, I want to just acknowledge how challenging technology issues are and the pace at which state tends to move in changing its technology around what you're recommending in particular. So I really do want to take that back and lift it up. And acknowledge that we have a number of projects around IT modernization, how to create more holistic support around the folks that we serve. How do we get to a universal client number? That conversation's been happening for at least 5 years now. And we haven't quite landed on a great solution yet. So I just also want to acknowledge that, like, some of this is just stuff that we're really grappling through within it, how we tie this together with some antiquated technology systems. But I really appreciate the question, and we certainly will take it back and continue to uplift and advocate for it, because it is a key thing that we hear frequently, is just the challenges and how our systems are linked and what it means for the end user.
And Maria, I want to lift up what Anna wrote in the chat. And then, of course, Anna, I don't want to speak for you if there's anything more you want to add, but what was written is, I would add emphasizing collaboration with partner agencies, especially considering potential cuts in funding across the board. And so didn't know if there was anything else you wanted to add, Anna, but definitely we want to key in on that as well.
Yeah, I'll just add real quickly that so I work for Section 8 housing, and a lot of our funding is contingent upon those MOUs with partner agencies. And I work in the foster youth, the FYI voucher department. And we have a great relationship with our local DHS office, and that collaboration has been really successful for the youth. So just continuing to strengthen that.
I love that. Thank you so much, Anna.
Absolutely. We very much want to see that as well. I can tell you that's one of the priority areas in terms of housing, and from our governor portfolio, as well as transition age youth transitioning out of foster care. So both of those are critical. And I know those aren't the only areas you wanted to focus on, but I think I want to bring those to the forefront as we're having this conversation because of how important they are. And very much so, absolutely want to emphasize the collaboration with partner agencies. So thank you for calling that out. And we are taking this information back, the thoughts and ideas that you're sharing, so that we can continue to use it to inform how we're moving forward. So I appreciate that.
Yeah, this is Maria. I think what I would like to add is that came up a lot when we were talking about this unified children and family continuum. When you start looking broader and thinking about social determinants of health, and I worked at Oregon Health Authority for a lot of my career and had the privilege of working early days of the current 1115 waiver, which has a housing component. And oh my goodness, was that work challenging? We at the state level in particular, like we didn't have the infrastructure and the relationships to really think through how to operationalize this incredible opportunity that we had. So also taking the opportunity now, talking with Oregon Health Authority around opportunities like that, thinking about how this could look differently when we also bring in the challenges that we have when we're stitching together behavioral health and Medicaid. So I really appreciate the call out. We've heard over and over again that housing is, really the cornerstone of stability and the path out of poverty for so many folks, and also recognizing that this is also a call out for us to partner better at the state level across social services and social determinants of health that aren't necessarily directly in our scope, but folks are tired of having to carry the burden of navigating that.
Where we are now is we just wrapped in April the finalizing of the roadmaps for how we aim to get, to the outcomes for the administrative functions, hubs, and the service delivery model and the unified children and families portfolio. And so ODHS has now entered, beginning May and now in June, a phase where staff from around the state are helping to create the detailed plans for implementation. We've really begun having conversations with community partners like yourselves. We're meeting directly with the Oregon's 9 federally recognized tribes, and our aim is to be thoughtful and engaging as we seek to transform our agency into one that enhances how we serve people and communities better across the state. Maria, what would you add about staying connected and some next steps and how we're kind of looking at this, 2-year timeline that we have?
Yeah, thank you. This is Maria. So what we're really looking at as far as the timeline is having the general design developed in order to sync up with the next 2-year legislative cycle, which I know sounds ridiculous when we're still in the current long session, but that is really where we need to be in order to ensure that we can plan and learn from some of the challenges that the Oregon Eligibility Partnership had with moving some staff around and just the challenges that created both internally and externally. So we will have the design prepared in late summer. We'll begin identifying the areas that need to go to the legislature, for example, changes in appropriation in order to unify program areas. And then we'll begin socializing that both with partners like you and with the legislature before the end of the year. We will also be taking that time to look at what parts don't need to be blessed by the legislature before we can begin implementation, because we have also heard both from staff and from partners how hard it is to get invested, to provide input, to give time and not see any changes happen. So we will be doing our best to toe the line and do both move thoughtfully and move with intention where we can. That does mean, however, that we cannot plan for full implementation until we have that next long session, rather, in 2027 behind us and can get that final appropriation. So that means that we have a whole 2 years to continue to talk about this and shape components of this at a deeper level, recognizing that what we'll have at the end of the summer is a high level implementation plan, essentially. As I said at the beginning, but want to reiterate, we are working on getting a website up that can have some materials for you and others to be able to access. We will also be sharing an email address and a feedback link at that time. Our goal right now is early July. We will be sure to share that through your self-sufficiency partners. And if there are delays in that, we'll be sure to notify them of that as well. But we've been really good at keeping to our timeline right now. So I'm optimistic.
So this is really what we have for you. We're grateful for this time. Please feel free to lift up any questions as we go. And with the leaders on this call, they can make sure we get them, use that link to get information. And just thank you so much for allowing us to be here and share space with you today.
Thank you.
Wonderful. Thank you, Sherelle. Thank you, Maria. Really appreciate you coming. And we are committed, like they shared, this is the beginning of the journey. And so we're committed to making sure that those recommendations as they're available, as information continues to come available, making sure that that is shared with this group and our external partners widely, even beyond the self-sufficiency programs for ODHS. So thank you again. And a quick pivot, but we do have one more presenter for this space for this hour, and that is our Youth Experiencing Houselessness program. And they have some exciting stuff to share. I won't steal the thunder. I won't take the stage from them, but I will go ahead and share this space now with, I believe you have Mel and Jen to share with us about that program and some updates.
Hi, good afternoon. Thank you. Yes, my name is Jen Kellum, and I apologize. I'm having just some technical issues right now. I'm trying to fix them, and then I should be on camera soon. But I work with the Youth Experiencing Homelessness program. I'm the internal agency and youth housing coordinator. And we do have a presentation that we're going to share. I believe Crystal's sharing that for us. And then I will go ahead and pause and let Mel introduce herself. And I apologize. I did not, I use she, her pronouns as well. So go ahead, Mel.
Awesome. Hi, everyone. My name is Mel Keller. I use she, her pronouns, and I'm the Community Engagement and Partner Support Analyst on the YEP team.
Awesome. So as I mentioned, we are part of the Youth Experiencing Homelessness program. We're also known as YEP. And we're going to just kind of talk a little bit today on an overview just of our program. We aren't going to go too far into depth on a lot of things, but we would love to do a presentation at any time for anyone that would like to have more in-depth information about the programs and the work that we're doing. And you can go to the next slide. So we do like to give just a little history of our program. A lot of people are familiar with our program a little bit in the community, and then some people are not as familiar with our program. So we're really trying to get into more spaces as much as we can. So I do a lot of the internal work, and then Mel is our amazing person. She's doing a lot of external work, and then we're just collaborating together as well, just to try to get more information out there. I will highlight that our program is continuously working with programs that we are contracting with and that are grantees to be able to work part of a network, as well as other programs to be able to provide a service to young people in the state of Oregon that are experiencing homelessness. So we're just working a part of a stronger network to be able to do as much work as we can to assure that young people have the resources and supportive services in place to be able to succeed. We're working in spaces such as suburban, urban, and rural areas. And we just believe as a team that as long as we can continue to bring work forward, we can try to bring opportunities for young people to reach their full potential. Our program did operate under a single person entity for about 8 years prior to 2022. So Matt Rasmussen, a lot of people are pretty familiar with Matt. Also, sometimes I've referred to this program as Matt's program. And we have now a team of 7, which is really exciting. But Matt did operate this program for over 8 years by himself from 2015 to 2022. And during that time, he really spearheaded a lot of efforts to really bring a lot of valuable knowledge forward, really talk about youth homelessness and working with our communities and partners, and just also working towards like being able to increase the funding and being able to bring more supportive services into play. We did see a increase in funding in 2020. This really was due to the COVID-19 pandemic. So it was more of a temporary expansion that was fueled by the pandemic. However, the momentum was able to continue into the bienniums following. So in 2023 to 2025, we were able to increase our funding a lot more during that time, which was able to further solidify the growth that we were looking forward to and just having a stronger growth trajectory. Next. So a lot of the work that we're doing is really working with a lot of people that are in the communities and working with our grantees. We're not doing any direct youth work. However, we are continuously overseeing contracts and grants processes. Mel works really hard with another member of our team to be able to like deliver troubleshooting to grantees as well as providing grantee workshops. That's something exciting that you could, that if you're part of that network that you could be able to attend, as well as we're continuously developing and advancing policy direction and just moving things forward while bringing knowledge forward, and then continuously tracking best national practices, seeing what's happening throughout the United States and see like where really youth homelessness needs are lying and how we can be more supportive, and then continuously pursuing funding opportunities. We're currently in our 25 to 27 biennium, or going into it, and we're working towards solidifying funding for that moving forward. And then just always trying to engage with youth and partners. And then we also work to maintain connections with our internal ODHS programs and staff. And you can go next. So one of the things that we really do like to bring forward is just bringing more information around the experiences, barriers, and statistics that really wrap around youth that are experiencing homelessness, and just also trying to like bring more knowledge forward. Often there's a lot of misconceptions around youth homelessness, and there's misunderstandings about what a youth going into homelessness, the reason for why they're going into homelessness, and what they may be experiencing. Also, often thinking that they can just return home when this is really not an option for them in some cases. And so just really trying to bring more information forward and just helping others to understand what youth experience, and barriers that do exist that often are geared towards not necessarily supporting youth that are experiencing homelessness, but also adults that are experiencing homelessness. And you can go next. So going into youth homelessness by the numbers, we're just going to talk about really what we've been able to see. And this kind of talks about what I mentioned before about like studying, best practices, also being able to know what is happening. And so we have seen that we, per our Corporation for Supportive Housing Needs Assessment, we have seen that there's 8,300 youth that are in need of housing and services every year. And we are also the 7th highest number of accompanied youth across the United States. And then we also are the 2nd state, tied with California, of the highest number of unaccompanied youth throughout without shelter throughout the United States. And that is based on the 2024 Homeless Needs Assessment. Next. And this is something that we really try to like bring forward and just bring some information forward, some of the statistics that do exist around youth that are experiencing homelessness. So young people who are experiencing homelessness are often particularly vulnerable. And as I mentioned before, returning home is really not always an option for them. And so we want to highlight that youth are really facing disproportionate barriers to accessing services, and that the system is really geared towards supporting adults that are experiencing homelessness, not youth. We really have seen that we would naturally have to double the current need of short-term and long-term housing beds in order to meet the current need that exists, not including the rising numbers that could exist due to like increased housing costs and just services being unavailable for youth to be able to access. We also want to highlight that there's 1 in 5 youth that are experiencing homelessness that have been victims of labor, sex trafficking, or both. They're also 2 times more likely to be identifying in the LGBTQI Two-Spirit plus community. And then they're at a 16% higher rate of being amongst the Black community, as well as LGBTQ Two-Spirit plus community. And then there's a 2.2 higher likelihood that they're American Native, Alaska Native, or Indigenous to experience homelessness. And then I'm going to go ahead and send it over to Mel, and she's going to take over from here, and hopefully I can get my stuff working. I apologize, y'all.
Awesome. Thanks. Next slide, Crystal. So we accept the challenge and do a lot to address this issue of youth homelessness in Oregon. Next slide. So the majority of our grantees fall into one of 6 categories. These include drop-in services, which are folks who have a space that is dedicated for youth to stop by between posted hours, sometimes 3 to 6 p.m. in the afternoon, all day on weekends, things like that. Places where youth can just get access to resources, case management, food, laundry facilities, showers, stuff like that. Shelter are our emergency shelter programs, usually 24-hour stays, not really long term. But transitional living projects, TLPs, are the kind of slightly longer term programs, usually around 6 to 12 months. Our host homes is a really cool and unique program where community members partner with a nonprofit to host a youth in their home. So similar to a foreign exchange student, except instead of a student from Spain, it's a student from your own town. And we have a bunch of really cool host home programs that are also very low barrier for more rural communities that are unable to, fund a full emergency shelter. We fund culturally specific services. We work with NAIA up in Portland and a few other groups doing specific services because we know that the youth who are most impacted by homelessness are those from minoritized populations. And then we also have outreach grants. So making sure that youth who are at risk for homelessness are connected to resources before homelessness even happens. Next. So we are serving youth who are not in the care of a parent or guardian, who are residing in places not fit for human habitation, who are couch surfing, who are doubled up. We have a very broad definition of what constitutes homelessness for our program specifically. Like I mentioned in the chat, we serve youth ages 14 through 24, although some programs that we fund only work with minor youth, others only work with youth over the age of 18. And there are a variety of reasons that young people find themselves homeless or unhoused. And similar to how every adult experiencing homelessness has their own story, their own reasons for how they got into a situation. Same with youth. It could be instability in the home or family life, abuse or neglect by parents, substance use, or mental health disorders. Next. So we have really expanded our resources over the past few years. Over the past biennium, so between 2023 and 2025, we increased the number of counties that we serve from 12 to 26. So we still, unfortunately, are not in all 36 counties, but we're getting there. We increased the number of funding opportunities from 24 to 61, thanks to a lot of the funding that we got that Jen mentioned earlier. We also increased the number of service providers, tripling our program presence from 13 to 42. We started our host home project, we increased transitional living program investments, and we partnered with College Housing Northwest to provide youth-specific affordable housing units and units for college students. Next. So youth in order to access services, need to be connected with one of our partner agencies. So we dropped the link to the website in the chat earlier. As a program in ODHS, we do not specifically work with youth. Oftentimes, different providers will have different resources or different ways of contacting. Verifying age and self-attestation of homelessness is really important, making sure that our programs are serving youth, and that it's up to the youth to determine if they need services. And then all of our programs work on individualized service plans. We know that every youth is different and needs different resources. Next. And then we also have a few special initiatives that we are working on and that we are excited about expanding in the next biennium. Next. So we have direct cash transfers, which are cash assistance given to youth in the 2023 through 2025 biennium. We served 120 youth. Each of those youth got $1,000 a month, no strings attached. And then they also got case management and support from local nonprofits across the state of Oregon in rural, urban, and suburban areas. It was a really fantastic project that when of the 107 or 120 youth who started the program, 90% listed themselves as housed by the end, meaning that that $1,000 a month was able to really transform the lives of these youth. We also had a targeted housing assistance program pilot, which was also in partnership with Point Source Youth, which is a national nonprofit dedicated to ending youth homelessness. This provided cash assistance for youth who might be at risk of homelessness. So really that prevention mindset. We also addressed youth-specific affordable housing rental supports. We started up our statewide youth action board, which is an advisory board, kind of like the YEP board of directors. Youth who have lived experience, many of whom, started out as participants in a program that we fund, and who now are really engaged and provide that youth voice in the work that we do. And then we've also been expanding our tuition and fee waivers so that youth who have experienced homelessness can access college in Oregon, the state of Oregon, at public universities and community colleges free of charge. So that's also really exciting. Next. And I think back to you, Jen.
Thank you, Mel. So yeah, we also have some really exciting future goals and plans that we're working towards, like having with our internal staff and just also like some of the external work that we're going to be doing. So one of the things that we're going to be doing is really having some more stronger connections within internal staffing. So Mel and I will be hosting analyst hours that's starting in July. It's going to be every third Thursday of the month. So we're really excited about that. And then we're also going to be connecting for office hours to be able to answer any questions. Just as our program grows and more information gets out there, we know that there's going to be a lot of questions internally about the work that we're doing, especially surrounding around direct cash transfers. And then we're working towards connecting with our community partners and then other community agencies to see how we can better support youth in Oregon who are experiencing homelessness and housing instabilities, and just seeing what we can bring forward to be able to be more supportive as we move our program trajectory forward, and just being able to really see like what needs are out there that more than what we know that we still can do more.
Oh, Jen.
More. And so we're just trying to do the best that we can to just be able to bring things forward further, to be able to be more supportive. Also, Mel and I, sorry, I don't know if somebody was trying to talk. We have a map that exists on our external website. Is it not working?
You're just cutting out a little bit.
Okay, I'm so sorry. Is it better, Mel?
Yeah. Yes. Okay, Jen's having some internet problems, so I'm just going to finish up. We're always looking to build more community partnerships and to connect with more organizations in Eastern Oregon. That's going to be a really good thing that we're building on in the future. Next. So we will drop these links in the chat and also provide them on the agenda afterwards or notes afterwards. We have a listserv for our newsletter that you can be added to. Our shared email address is very long, but pretty self-explanatory, Youth Experiencing Homelessness Program at odhs.org and .gov. And then if you're interested in learning more about our programs, if you're interested in learning about DCT, direct cash transfers, or anything else that we're doing, we'll include a presentation link request as well. Next. And then these are the contacts for our team. We all do really great work, and we'll include our emails afterwards as well. Thank you all for staying a little bit over, and thank you, Catherine, for this opportunity.
Thank you all. Thank you, Jen. Thank you, Mel. Appreciate it. And thank you all for sticking around. I know we went a little bit late, but we anticipated that it might, given our large topic at the leading part of the hour. So thank you so much, YEP team. Really, really wowed by the work that you're doing and what's ahead. So and thank you all for joining. I threw an evaluation link in the chat just a bit ago, but would love your feedback to help inform future presenters to make this space as applicable and just valuable to you as possible. But appreciate you all joining, and I hope you have a wonderful rest of your day.